The founding of the Black Caucus at UCSF in 1968 is a landmark in the social justice journey of UCSF. Back then, African American custodial employees at UCSF were known as the basement people because, regardless of which floor they were assigned to work on, they had to return to the basement for their breaks, to use the bathroom, and to have their meals. The elevators only went to the ground floor. The basement people went on strike during this time, demanding two things. First, a revolutionary change to create better working conditions for themselves. And second, an evolutionary change. They wanted more African American doctors at UCSF, and so they demanded more opportunities for blacks to enter into our medical school. Their bravery and their vision led UCSF to reflect on the importance of diversity in healthcare and to commit to changing our admission procedures. Today, the working conditions for all our employees have improved, and more than 35% of each class at the UCSF School of Medicine comes from groups that are underrepresented in medicine. As proud as we are of this diversity, it took another several decades and another group of courageous and visionary people to catalyze the next landmark steps towards social justice at UCSF. We recently commemorated the 5th anniversary of the UCSF student-organized White Coats for Black Lives die-in. Troubled by grand jury decisions to not indict police officers who were involved in the deaths of two unarmed African-American men, Michael Brown in Ferguson, Missouri, and Eric Garner in New York City, a core group of UCSF medical students and campus allies reached out to their peers across the U.S. to organize a day of action. The result was a series of die-ins around the country, with medical students donning their white coats and lying down in peaceful protest to call for institutional change, especially in regard to health care and medical education. The students held a mirror up to us and said, "You have to do more than simply pronounce that you believe in diversity, equity, and inclusion. You actually have to do the hard work to unravel the consequences of structural racism in our society and our school." They asked us, what were we doing to make the Bay Area and beyond a place where all could thrive? And the answer was, not as much as we should or could do. The die-in was a watershed moment for diversity, equity, and inclusion throughout UCSF. Less than a month away from our annual School of Medicine leadership retreat, we made the decision to shelve plans for a leadership retreat on partnerships and instead convened a retreat to focus on race and racism at UCSF. In an intense day and evening, we heard story after story from a diverse group of students, faculty, and staff at UCSF about the way their journey to and through UCSF had been impacted by structural and interpersonal discrimination. In the year that followed the die-in, the UCSF chapter of White Coats for Black Lives became the seed for a larger discussion about diversity, equity, and inclusion on our campus and in the communities UCSF impacts. Inspired by the impassioned efforts of our students, the UCSF School of Medicine developed the Differences Matters initiative, a multi-year, multifaceted School of Medicine initiative designed to make UCSF the most diverse, equitable, and inclusive academic medical system in the country. This initiative provides financial support for the time and effort of 20 faculty and professional staff to develop and implement initiatives that drive structural change to increase diversity, equity, and inclusion in 6 critical areas of UCSF: leadership, climate and recruitment, learning environment, research action group for equity, clinical health equity, and pathway outreach and pipeline. This infographic outlines some of the many ways we've moved the needle in each of these areas over the last 5 years. For more specific Differences Matters programs and interventions, please visit differencesmatter.ucsf.edu. Within the UCSF community, we have the knowledge, expertise, and drive to transform our institution so that it reflects the diversity of our patient population and so our learners are educated in a way that actively combats the adverse health outcomes that directly result from structural and interpersonal discrimination. These are big topics to address, and there's no silver bullet solution. But we can make a difference if we all remain focused and committed to creating a diverse, equitable, and inclusive environment for all our patients, our faculty, our staff, and our learners. Thank you for having the courage and vision that instills hope for the future of health and healthcare. Together, we will advance health worldwide and ensure that all Americans have the opportunity to make choices that allow them to live a long, healthy life, regardless of their income, education, or ethnic background.